Hi everyone, today I briefly explain to you about the bioidentical hormone replacement therapy. So once we receive the saliva test results, we discuss treatment options. The best and safest way to deliver estrogen is transdermally through your skin. And the beauty of bioidentical hormone replacement therapy is that you can pick and choose the good type of estrogen. The E2 and E3, the correct dosage, the percentage like 50-50, 70-30, and you can add other hormones like progesterone, testosterone in the same cream. So before prescribing, we have a full discussion with patients regarding the risk and benefit of bioidentical hormone replacement therapy, the importance of regular follow-ups. Patient read through the consent form and sign it, and once agreed, we prescribe a 3-month supply. It is sent to compounding pharmacy, and a follow-up is arranged after 3 months. So if you're interested in discussing this further, so please book an appointment with one of our clinicians at Zen Healthcare for a free 10 minutes consultation. Thank you.